United Nations assessment revealed that 2.2 billion people all over the world have no access to potable water, and about 4.2 billion have no access to safe sanitation. So these have greatly affected health outcomes, especially among women and children. And the theme for this year's World Water Day, which is observed every 22nd of March, is valuing water. The value of water, as we all know, cannot be overemphasized. The lack of it can lead to several water-related diseases. And that is why we in Mercy Corps, under the USAID Small Town Wash Program, are committed to providing 140 inhabitants of the state of Adamawa, Borno, and Yobe with access to safely manage water supply and sanitation services. We are also committed to responding to the prevailing COVID-19 situation globally. So far, we have been able to install hand washing facilities in strategic locations of public institutions such as schools, health centers, markets, and motor parks. We are also creating awareness and advocacy in the area of self-distancing and wearing of face masks, and generally observing the COVID-19 protocols. And to have access to water alone is not enough. But what we are advocating for is to ensure that we have access to safely manage water and sanitation services, which is in line with the SDG 6, and which states that by the year 2030, individuals globally should have access to safely manage water and sanitation services.
Water, they said, is life, and I want to believe that for daily survival, we need water in our lives. Also looking at the current situation we find ourselves in, talking about the COVID-19 pandemic, water is very important. It's very vital for us to have water supply across all our locations, in our homes, to ensure that we regularly wash our hands with water, and then of course with soap. This is actually one of the things that is being encouraged by WHO, that we should regularly wash our hands with water and soap. So therefore, water is very important in our homes, in our offices, wherever we find ourselves. And our humanitarian response, we ensure that we work with community level volunteers that we term as community hygiene promoters, who actually go from house to house, different communities, sensitizing people on how to regularly wash their hands, keep their environment clean, and of course imbibe that culture of regular hand washing. Also, part of the things we're doing in order to address COVID-19 in our different intervention communities is installation of hand washing stations, and then of course ensuring that there's water and soap in those points regularly, so that people can actually be washing their hands whenever they go, whether it's they go into the latrine or they are sitting in their various communities. There should be a kind of access to water, especially within where they interact, so that at the end of the day they can wash their hands and then prevent themselves from being infected. We know that people are not really used to the wearing of face masks, so having water regularly will in a way help them, because as soon as they touch any space, they can quickly wash their hands to avoid being infected.